Good afternoon. My presentation today, my awareness session is going to be about child or children first aid and saving lives. In this awareness session or in this presentation, I'm going to highlight some general safety tips, different first aid situations. I'm going to highlight also child safety inside and outside the house and how to do CPR for children and for infants. First of all, the very important thing that we should know, everybody should know, is the emergency numbers. Inside Aramco, if you are living inside the camp, the emergency number is 911. So you need to dial it from your mobile, from landline 911, or assign somebody else to call this number. If you are living or you are outside Aramco camp, the emergency number outside is 997, which is the ambulance. If you face an accident, if there is any situation inside the house, if you see any child in an emergency situation, just grab your phone and dial 997. If there is something related to fires, you need to call the civil defense on 998. In case of emergency, a lot of people, especially parents or caregivers, tend to get panic when the affected person is a child or infant. We are trying to spirit that don't get panic. Just hold yourself on. Call emergency, grab your phone, call emergency, or assign somebody else to call emergency, and deal with the situation according to what you will see. At least if you don't know what to do, calm the child, stay beside the child, observe them until the emergency team arrive. Get the first aid kit. First aid kit will help you a lot, especially if the situation is injury or burn or whatever, to help you. So first aid kit should, and you will find it in the pharmacies outside, in the areas or shops that sell medical equipments. Area that first aid kit should be around or should be available is at your house or at your home, in the schools, playground areas, in your car, and recreation areas, the areas that have restaurants, skatings, whatever, and restaurants and coffee shop areas. So first aid kit should be on these areas. The contents of the first aid kit. Some people ask what we should put inside the first aid kit. First aid kit usually comes generalized with the equipment generalized with all the first aid kit. The important thing that you need to see in your first aid kit, or you need to refill it if it's not available, which is sterile gauze, bandages, different type of bandages, arm sling in case of fractures, scissors, tape for to fix the gauze or whatever, gloves, normal saline, if there is a normal saline, burn cream or burn dressing. If also, if it's available, you can also put antibiotic ointment in case that you need it. So this is the main contents of the first aid kit that should be there. Any extra accessories, you can put it in your first aid kit if you like to buy it from outside. Now, children, especially toddlers and infants, learn by touching the objects, or by exploring. So if you leave small object on the floor, like toys, like medications, like coins, kids tend to put these objects in their mouth. So what we have to do as parents, as caregivers, we need to remove all small objects away from toddlers or infants' reach, or children, so they will not put it inside their mouth and they will end up in worse situation like choking. So I'm going to highlight now choking in infants. Choking is a very serious situation. mother, father, parents, caregivers needs to act immediately if the infant is choking. When we are talking about infants, infant is from age 1 year and less. By American Heart Association, which is our resource, we call them infants. So when you have an infant and you can see that the infant is choking, how you know that the infant is choking? You will see a blue face, no sound will come out from the mouth, no crying. Uh, Infants tend to have blue lips and blue area around their nose. So when you see an infant like this, act immediately. Assign somebody to call 911 or grab the mobile, dial 911, put it in the speaker beside you while you are helping the infant through the choking. If you don't know what to do, emergency people will guide you to what to do while you are listening to them, and they will dispatch an emergency car to come to you. So, what you need to do when you see an infant choking, first of all, grab the infant's face down with you can look at the right picture, with your arm, support the infant's face and body on your arm, put the infant's head a little bit down on your thigh. Start to give 5 blows, not very forceful and not very light. In between, deliver 5 blows in between the shoulder blades of the infants, upward. So you are helping the object to move from the airway to the mouth outside when you are blowing this 5 blows. So do it 5 times, 1, 2, 3, 4, 5. Then turn the infant face up. If you see the object in the mouth, remove it. If you didn't see the object and the infant is still blue and not making any sound, start something called chest thrust. Using your index and thumb and mid finger tips, press on the area between the nipples. Imagine that there is a line between the nipples. Put your thumb and index finger in the just below this line and start chest thrust. How many chest thrusts you need to give? 5. So 5 back blows in the back of the infant, then 5 chest thrusts. Repeat this procedure. Repeat. Turn the infant again, give 5 blows. Turn the infant again, give chest thrust until the object comes out to the mouth and you can see it. Once you see it, remove it. Never do blind sweep. Mother tends to put their fingers inside the infant's mouth to try to remove an object that they can't see. This will cause the object to get down further in the airway and situation become worse. Even it may lead to death of the infant. So don't do blind sweep. If you see the object, remove it. If you didn't see the object, keep doing the same procedure until the emergency team arrive or the ambulance arrive. This is for infant choking. How about children? Children, when we are talking about children in American Heart Association description is from 8 years and less. You can say from 1 year to 8 years, they are children. This is the age of children. So, if you see a child is choking from a food, from toys, from small balls, from coins, from anything, immediately again, don't get panic, call emergency or assign somebody to call emergency number. Kneel behind that child on your knees and make the child back to your chest. So put the child back to your chest while you are kneeling behind the child to be on their level. Circulate your arms around the child's waist. Make a fist with your hand and make a second fist with your other hand. Put it a little bit about the umbilical area before the belly button and start to push inside. Thrust. It's called abdominal thrust. How you will do this abdominal thrust? You will push inside, up, inside, like inside to up a little bit. This way you are gonna force the object to come from the airway and come out from the mouth. So how many times you will do it? As much time as you can. It's not defined by 5 times or whatever. So keep doing it. It's called abdominal thrust or helmet maneuver. Keep doing it several times until you see the object comes out from the child's mouth. It's advisable or recommended to put the child's face a little bit forward, so the gravity will help that object to come out while you are doing abdominal thrusts. So this is for children. Now, before we move to the next slide, in case you come to this infant or this child, they were choking and no sound coming, and they are blue, they can't speak, but they are still conscious. For the children and for the infant, they are still conscious. They are opening their eyes. You have to do the choking first aid, like I taught you before, for the infants and for the children. In case this infant or this child lose consciousness, they close the eyes, you are shaking them, you are calling them, they didn't wake up. Immediately, we have to prioritize on CPR, cardiopulmonary resuscitation, to save their lives. Because when they become unconscious, that means that the object is very deep inside the airway, that it's blocked the airway or the air to come to the lungs. In this situation, if we didn't do CPR, the children or the infants may die. So how to do CPR, I'm going to cover this part in the end of this presentation, towards the end, for the infants and for the children. For seizure or convulsions, the cause of seizure or convulsions is sometimes hyperthermia or fever, sometimes from some drugs that the children take, or infants take, it cause convulsions or seizures for them. Sometimes from epilepsy, sometimes from falling from high distance, sometimes from head injuries. So whatever the cause, when you see a child who have seizure or convulsions, involuntary convulsions, what you have to act as a parent or a caregiver, gently place the child on the floor. If they are standing, lay down, or they are on the sofa or whatever, lay them down on the floor. Remove any side objects from around them, like chairs, like tables, so they will not injure themselves, hurt themselves while they are doing the involuntary movements. Loosen any cloth around their head or neck to prevent any blockage for the airway while they are through the seizure convulsions. Make sure the child is breathing okay. During the seizure, a lot of parents or caregivers tend to open the child's mouth or put an object inside the child's mouth, like a spoon, like a piece of food, whatever, to prevent the child from biting their tongue. We, as a American Heart Association instructors, saying, don't try to open the child's mouth or don't try to put any object in the child's mouth, because it's going to cause harm to them. It's going to cause them damage. Leave the child. Once they finish the seizure cycle, or which is take 3 to 5 minutes maximum, or once they finish the convulsion, now you can treat if they bite their tongue or if you see any bleeding or whatever. Also, don't try to put your fingers inside the child or infant's mouth. If the child is bite on your fingers, you may lose your finger, or you may damage your fingers or cause bleeding to your fingers inside the child's mouth, which is not acceptable or not recommended. So once the child once the child finish the convulsion fit, or the seizure fit that they have, try to lay them on their side. Make sure that they are breathing okay and there is nothing blocking their airway. If you see any bleeding coming from the child's mouth because they bited their tongue or whatever, ask for the first aid kit, put the gloves, just press on that bleeding, on the tongue, on the mouth. Observe the children, stay with them until they become okay. Most of children tends to get sleepy after the seizure fit or the convulsion fit. Just stay with them until the seizure finish, then lay them down, and that's it. Now, if the seizures stayed longer than 5 minutes, or it comes as several attacks of the seizure in the same time, don't wait. You need to call emergency or ambulance to come and take that child to the hospital or infant. Now, bathing and drowning. You know that toddlers and small and infants, if they are left unobserved inside the water, they tend to drown and, God forbid, die. So just small safety tips when you are giving birth to your infant. Check the water's temperature. You don't want to burn that infant, or that you don't want to burn them with the hot water. Their skin is very soft. It's not like adult skin. So you need to check the temperature of the water to be warm, not hot. You need to keep the infant's head out of the water all the time, supported with your arm, or you can put a bunch of cloth under the infant's head while the water is shallow. Don't ever leave the infant inside the water unobserved. If the water is above the liver or the infant turn their head, you never know, they may swallow water or they may drown and, God forbid, die. Same with children. When you are giving birth to your child, make sure the water's temperature is okay and acceptable, warm. If you want to give them bath, you have to make sure that the child is sitting inside the water, not lying down. Water should be below the waist level, and don't leave the child alone inside the water, or your children in general inside the water, because they may die, or they may drown and die later. If you find a child or infant drowned, what you need to do, I'm going to cover that in the CPR part. You need to start CPR. Call emergency and start CPR immediately. Cardiopulmonary resuscitation. Save the life. Now, another critical situation children may face, which is severe allergic reaction. Some children have severe allergic reaction to some types of food, like fruits, like eggs, like chocolate. Some of them, they have severe allergic reaction to insects bites, like ants bites, bees, whatever. Some of them have severe allergic reaction to some medication. What is the signs and symptoms of the severe allergic medication? Children, if they have severe allergic medication, they tend to have swollen face, swollen tongue, swollen lips, difficulty in breathing, shallow breathing, swollen eyes. Some of them, they will have hives, which is itching, like hives, like rashes on the arms, on the legs, and in the face, and itching with it. Once you see a child who have severe allergic reaction, don't hesitate. You need to call emergency immediately, either from your phone or assign somebody to call emergency. Now, if the child have a epinephrine pen, epinephrine pen is like you see in the picture. It's a special type of medication or injection, self-injected medication given to the children or adults who are suffering severe allergic reaction. You need to be trained on the epinephrine to know how to give it. It's injectable, but you need to be trained on it. Once you call 911 and you have the EpiPen, you need to remove the blue cap or the cap from underneath. Make sure to press the epinephrine tip, which is the orange part, on the child's thigh on a 90-degree. Press. Once you hear the click, keep it for 10 seconds inside the skin, or pressed on the child's thigh, in the side of the thigh. If you remove it quickly, the medication will not go inside the thigh. So once you hear the click, keep it 10 seconds until you make sure that all the medication is inside. Then you can remove it straight and rub the area with gentle massage until the emergency team arrives. Children also learn by exploring, especially if when they go to the kitchen, they like to see the hot water, or they like to touch when they see the smoke coming out, or they like to just see the fire. So make sure to close the kitchen door when you are cooking, or to put a protective barrier around the oven to protect from the children, or just keep your children or infants away from the kitchen, especially when you are cooking, or from any heater source, like iron, like heaters. So if the child touch any heat source or heater or iron, they may have burn. We have 3 degrees of burns. One is called first degree burn, which is superficial. The second degree burn is a little partial thickness inside the skin. And the third degree, as you can see from the picture, is full thickness. The burn will reach to the bones and to the blood vessels and to the deep tissue. So to make it more clear, the first degree burn is called superficial or scald burns. Happens from hot water, from touching hot surfaces quickly. This burn is painful, but it's just on the outside layer of the skin. You will just see redness on the skin, as you see in the first picture. How you will do the first aid, I'm gonna cover that later. Second degree burn is the partial thickness. The burn will go cover the derms and the epidermis of the skin down to some of the tissues. It's painful burn. It comes from heat like heater, chemical burns, or oil burns. Most of these burns will need a surgical operation, which is grafting, especially if it's second degree deep burn. The third degree burn is a full thickness burn. It's go through the dermis and the epidermis, and as I said, covers burn the tissue, burn the skin layers, even reach the bones and the blood vessels and the nerves. So this burns usually comes from chemical burns, electrical burns, or fire burns. Most of these burns are life-threatening burns. So when you have a burn, when you have a child who burned his arm, his hand from a scald burn or from an iron, whatever, what you need to do as a first aid, you need to take that burned area and put it under cool running water for 10 to 15 minutes to cool the skin, to cool the area, to reduce the burn, the feeling of pain. Don't use ice on the burned area. Ice may damage the underneath layers of the burned area. So just use cold water. And once you're in, Okay, guys, I'm sorry for this technical issue. We will continue from here. We were talking about the burns, the first degree and second degree, which is superficial and second and partial thickness burns. You need to rinse the burn area under a running water, as you can see here, and apply a sterile dressing on it from your first aid kit at home or wherever you are. Don't put ice on the burnt area. Ice may damage the area and make it worse. Never apply cotton balls, it may have particles that may go inside the skin. Don't use home remedies, as I mentioned. For the second degree burn, for the third degree burn, the fire burn, a fire burn or electrical burn or chemical burn comes from, as I said, from the fire. Okay. Use antibiotic ointment as a burn cream on the burn of area and put a loose dressing, sterile gauze and loose dressing. Why you are not allowed to put tight dressing? Because burn area tend to get swelling. So if you put tight dressing, it's gonna cause more damage to the burn area. So try to just put burn dressing and wrap it with any bandage. Then if the situation is worse or the burn area is larger, you have to take that child to the hospital or call emergency. Don't use home remedies like eggs, like salt, like oil, like toothpaste, like anything. It may cause damage to the burn area. Remove any accessories. If the child is wearing rings, watches, or belts, or whatever, try to move them because, as I said, burn area get to swell easily. Seek medical help if you see that the burn area is larger than you expected or or blisters start to show out up. Take that kid to the hospital or call emergency. If it's just light burn or which is the superficial burn, you just can't treat it at home and give your child a painkiller. In case you have a child who have electrical burn, what you need to do as a first aid at your home? Turn off the source of electricity immediately. Assign somebody to go to the main electrical source and turn it off. Try to remove or to keep that child away from the electricity by using a non-conducting object like plastic, like wood, like cardboard, like anything. Try to move that child from the area of dangerous zone, so you will not put yourself also in that dangerous zone. Immediately observe for signs of breathing. If the child is breathing normally and they are still awake, stay with them, calm them down, cover them to keep their temperature and call emergency immediately. Now, if you find the child or the infant is unresponsive, you shouted for them and they are unresponsive. You found that they have very shallow breathing or no breathing. Immediately you need to begin CPR, cardiopulmonary resuscitation, to save their lives. While at the same time, you already assigned somebody to call emergency. Try to prevent the burned child from become cold. As I said, if they are awake, try cover them with blanket, warm blanket or blanket. You will find the blankets in the first aid kit. Comes like foil. So just take it out and cover the child with that blanket to keep their temperature so they will not get cold. And if you can see a burned area from the electricity, don't rinse it with water. Just cover it with sterile dressing and sterile bandage and clean cloth until the emergency team arrive to take the child to the hospital. Now, If you see, God forbid, a child on fire, gets fire from any source, what you need to do? You need to put the fire out, either yourself by dropping any blanket, any wet sheet or whatever on the child to put the fire out, or ask the child if they are aware and they can listen to the command to stop themselves instead of running. Stop, drop themselves on the floor and start to roll and roll and roll until the fire goes out. Now, once the fire is out, immediately assign someone to call emergency or call emergency yourself. Protect the burned person from further harm. If they are in the near and a dangerous zone or whatever, move them to a safety zone if you can. Protect them from any furniture, anything around them. Make certain that they are breathing normally. If they are not breathing or unconscious, immediately start CPR. Start rescuing that child. If they are wearing any jewelries, belts, rings, whatever, remove them, because again, burned area, especially in the neck, tend to get swollen. If the neck area is swollen, it will affect the airway. So try to remove any jewelries, anything. If you can, cover the burned area from the fire with moist bandage and clean cloth or sterile bandage until the emergency team arrive. Don't wet the burn area, don't put water on them. Just once you put the fire out, check the child's temperature. If the temperature is down, you need to cover them with the blanket that comes in the first aid kit, the warm blanket, to maintain their body temperature. If they go on hypothermia, it will put them in a critical situation. If you can, if the burn in the extremities, arms or legs, raise that area, elevate that area while you apply the bandage and wait for the emergency. Watch for signs of shock. Some people, when they get, some children or in general, patients or persons, when they get fire, they will go in a shock. What's the shock signs? They will get like confused. They will become pale skin, pale complexation to white complexation, shallow breathing or fast breathing. Try to calm them down. Reassure them that everything is okay and the emergency is coming and we are beside you. Stay with them, observe for signs of losing consciousness or stopping breathing until the emergency team arrive. First aid for wounds. You know, children likes to play and fight and go to the playground area and the toys, so they may get injured faster than other ages. So if you see a child who have a bleeding in general, if there is a bleeding, how can we deal with the bleeding? First of all, you need to wear protective gloves. Ask for the first aid kit, put the gloves on. Take a gauze from the first aid kit and press it on the bleeding area, regardless. Do the pressure with your hands, with your fingers. Keep pressure for 5, 10, 15 minutes until you see no signs of bleeding at all on the gauze itself. Once the bleeding stops, you need to wrap that area with a sterile bandage from the first aid kit. So this is general tips how to deal with any bleeding. Now we'll go on specific details. If you have a nose bleeding, you know, a lot of people or a lot of children, they have nose bleeding from standing in the sun, from playing, from getting hit by objects, or just physical body reaction to anything, they will have nose bleeding. If you see a child who have nose bleeding, what's your first aid kit? How you will deal with it? What's your first aid tips? Ask the child if they are aware enough to pinch their nose from the soft part of their nose with a clean, sterile gauze or bandage, and move their head or put their head forward, not backward. If they cannot control that with themselves, you need to do it for them. Grab a gauze, grab clean towel, clean tissue, press with your index and thumb on the tip of their nose with the gauze and ask them to move their head forward, not backward like in the old days what they used to do. Moving the head backward while it's bleeding, if there is a clot of blood, it may go to undesirable areas like sinus or whatever. So just move the head forward, pinch the nose until the bleeding stops. If the children tends to have a lot of bleeding, nose bleeding, you need to seek medical advice. You need to see a doctor. Maybe they will need further procedures for that bleeding. First aid for injuries. Eye injuries. Eye injuries happens from an object goes inside the eyes, like some sharp objects, sometimes sand, sometimes pencils, pens, whatever. If you see a child's eye injured, which is redness and there is tears coming out, you need to rinse that eye with saline solution or clean water, running water. So go to the sink or use a bottle of water and rinse the affected eye. When you want to rinse on the side, you need to start from the not affected eye. So ask the kid to put their head sideways and start raising from the side of the non-affected eye to the other one. Because if you start versus that maneuver, if there is sand or anything, it will go to the non-affected eye. So while you are rinsing the eye, ask the child to blink repeatedly, blinking while you are rinsing. So if there is any object inside it, it will come out. It's like washing, rinsing the eye. Blinking will help get rid of small bites or dust or sand in the eye. Don't avoid or prevent the child from rubbing their eye. I know it's gonna be itching, but prevent them from rubbing the eye. Rubbing may cause damage to the tissue and make it more red and more injured. If the children are wearing contact lenses or glasses, you need to remove the glasses and the contact lenses. Don't use any eye drops from home. You need to seek medical advice. They need to see the doctor for that eye injury. Don't use any medication without prescription from the doctor. If you can, cover the injured eye with a patch until you will take the child to the emergency or ask for the emergency to arrive, to come. Head injuries. Head injuries happen from falling from high distance, from banging the head with any object, heavy object, whatever, or just fighting. Children tends to fight together. So if you have a child who have head injury, what you need to do, again, is the same first aid tips. If you see any bleeding, you need to wear protective gloves and do the first aid for the bleeding. But if there is no bleeding, just calm the child, stop any bleeding if present, apply an ice pack on the swollen area. Usually head injuries end up with swollen area in the head or swollen forehead. So just apply an ice pack or whatever and rub it with the clean towel or something and put it on the swollen area. Observe the child. Just stay beside the child, calm them down and observe them. You need to observe for what? For the head injury, to know that the head injury is not serious. You need to observe for headache. If the child have headache, headache. Dizziness, if they are dizzy, they cannot walk straight or stand straight. If there is any vomiting, if there is any convulsions or seizure, in this situation, you need to call emergency immediately. Seek a doctor, care for that child. Because maybe they need further investigation like x-rays or something for the head. Broken bones and ankles injury. Again, you need to wear protective gloves, calm the child, Don't move the broken area or the broken bone. Don't try to move it. Try to fix it, actually, to fix it with a device, either a magazine, either a stick, wood stick or something. Just try to fix that broken area and elevate it up so it will not get swollen. If this printed ankles or something, you need to apply an ice pack on the broken bone or splinted area to reduce the swelling. As I said, if you have a bandage, the fracture bandage is called the ACE bandage. On your first aid kit, you need to wrap the bandage on the splinted ankle or broken ankle. But if it's broken bone in the arm or leg, you don't have to put any bandage. Just fix the area with magazine, with wood stick, with anything, and call emergency or take that child to the emergency. Amputation. Amputation is one of the very painful situation for the child and for the parents also. Amputation happens from any sharp objects or a door, especially toddlers when they, or infants when they like to put their fingers in the inside part of the door, any door. So if there is an amputated finger, an amputated toe, immediately we need to call emergency on 911 or 997. Have the injured child sit down or lay down, because if they see the blood, they will get dizzy, aside from the pain that they are in. So ask them to sit down or lay down and elevate the injured area or the amputated area as much as you can to prevent the excessive massive bleeding. Ask for the first aid kit, apply pressure on the wound until the bleeding stops, then wrap it with bandage. Keep it up, elevated. Give the child a painkiller if you have at home. Now, what to do with the amputated part, amputated finger, amputated toe? You need to save that part. First of all, rinse it under running water, not hot, not ice, cold water, just regular cold water. Once you rinse it, don't rub it, don't scrub it with soap, just rinse with water. Rub it with sterile gauze, that amputated finger. Rub it with sterile gauze. Take that gauze and put it inside the plastic bag. Once you put it inside the plastic bag, bring another bag that have ice and water and put that bag inside, as you can see in this picture. I don't know if you can see the cursor. So this is the amputated gauze finger inside the gauze. Put it in a sterile bag, then put that sterile bag in another bag that have ice cubes and water. Then take it with you to the emergency or to the doctor, so the doctor may detach again this amputated part. Plastic surgeons usually. No. Poisoning with medication. Again, we will continue that. Kids like to explore things. So if you have a medication that is reachable for your children and they can open it, they may swallow that medication. If they swallow that medication, it may cause poisoning for them, aside from choking if they are small children. So to prevent all of that hassle, just put the medication, keep the medication in a closed cabinet away from the reach of your children. Up. So if you have a child who's poisoned from medication, immediately you need to call emergency right away. Okay? You can't give them any solutions, any water, anything, just call for emergency, because they may need further procedures to remove or to take that medication out of their stomach. Gastric lavage, it's called gastric lavage. Viral or bacterial gastric infection. A lot of kids, they get, or adults, but usually kids tends to get viral or bacterial gastric infection from eating some types of food, from getting cold or whatever. So when you have a child who have bacterial or viral infection, gastric infection, wash your hands and their hands regularly with soap and water. Give them fluids regularly as much as you can so they will not get dehydrated. Especially these kids will have diarrhea and vomiting. So when they have diarrhea and vomiting, they will lose fluids from their body. When they lose fluids, they will get to tend dehydrated. So we need to give them hydrated with fluids. When you are feeding them, give them little meals that often include some salty foods. Don't give them large portions because they may vomit that. So try to give them little meals occasionally or regularly during the day to maintain, so that meals will stay in their stomach, it will not get out. Give them food or drinks that have potassium, like fruit juices, like bananas, like apple juice. Don't give any medications without consulting the doctor, because if you give them medication and they have vomiting, they will vomit that medication. So consult the doctor, the best medication for them. Take the child to the emergency if they become severely dehydrated for fluid enhancement, for fluid therapy. So they will be dehydrated in the hospital. Of course, for the safety tips, we need to wash the fruits, the vegetables, wash the hand regularly for the kids, for the children. If they are playing outside, you need to use the sanitizer, especially these days with the pandemic situation. You need to keep the sanitizer with you. Sanitize their hands after playing. Wash their hands after using toilets. Wash any fruits, any vegetables. So hand washing is very important to prevent a lot of diseases or a lot of dangerous situation or situation that you don't want to face. Also so this is handy. This is about washing the hands. From the safety tips, I just put them in pictures here. I will elaborate it a little bit more. From the safety tips that we need to maintain for ourselves, for our children, is healthy food, small portions, but healthy food, washing the vegetables and fruits as usual, and maintaining the weight of our children is important too. If the children get to be overweight, you need to consult a medical advice. There is clinics now in the hospitals that they will follow the child with dietitian, with exercise, with medical follow-up. If you have infants, don't leave them unattended in their beds. You need to raise the side rails for the bed. Don't put them in a high place that they can fall down from it. So you need to supervise them all the time if you put them in an area that they may fall down from it. Immunization is very important. Keep the immunization record for your children and your infants, and follow up with the immunization as prescribed from the nurses, from the doctors. You need to seek medical advice. You need to get your child, your infant, to see the doctor on a regular basis, just to do checkups on them, to advise you about the immunization, to advise you about any other situation. Letting the kids to play is very important. It will kids like to play, so take them to the correct areas to play, not in the streets, in the playgrounds. If you can enroll your children in a gym to do exercise, it's very important also for their health, mind, and healthy body. So this is some general tips, safety tips to maintain for your child to prevent any other situations. Smoking. You know that there is some parents are smokers, and if these children are sitting beside the smoking people, they will have something called secondary smoking. They will be a smokers, but in a secondary way. So if a father or a mother sitting beside that child and they are smoking beside them, all that smoke will be inhaled by that child, so it will go to their lungs. So they just look like they are smoking without smoking. So this is why it's called secondhand smoking. Secondary smoking, often secondary smoking, if it happens a lot, it may cause on the further run a frequent severe asthma attacks for the children, respiratory infection like pneumonia. It may cause ear infections. It may cause sudden infant death syndrome. So, of course, as a safety tip or as a first tip, aid tip, don't smoke beside your child. Try to smoke in an area that away from your children. If your children are with you in the car, try to not smoke inside the car. Try to smoke outside the car, or at least keep the windows open. Now, we finished the first aid part about all the situations or the medical situation that I covered, which is choking for infants and children, burns for infants and children, seizures and convulsions for infant and children, injuries in general for infant and children. Now we'll come to the second critical part of the first aid, which is saving the life. It's called CPR, cardiopulmonary resuscitation. You can say there is two main signs, two main signs. Once you see them, you will know that this child needs CPR immediately. Number one, or two main indication. Number one, the children or infants, I'm talking about infants, let's take infants now. Infants will become unconscious. Number two, difficulty in breathing or no breathing. So the two main indicators for CPR for infants and children is two things. Number one, unconsciousness. Number two, stopping breathing or shallow breathing or gasping. It's called gasping. So if we have an infant who become unconscious for any reason, we grab the foot of that infant, we tapped on the foot of the infant, and the infant didn't wake up. There is no sound, nothing coming from the infant, no crying, he's unconscious, and I'm looking at the chest is not moving, so they have no breathing or they have very shallow breathing, it's called gasping. What we have to do? We have to immediately lay that infant on a hard surface, which is the floor or a table. Start something called chest compressions. Start pressing on the chest. Where to press in the chest? As I mentioned before, between the nipples. Just draw an imaginary line. Put your thumb and index fingertips on that line and start to press 90 degrees. How you will press 90 degrees is called chest compressions. How deep you will go inside the infant's chest? 1/3 of the chest. So you will go 1/3 down because you need to make sure that you are massaging the heart when you are doing that. So how many chest compression you will do for an infant? 30 chest compressions. So you need to count 1, 2, 3, 4 until you reach 30. Once you finish 30 chest compressions, open the airway of the infant. How to open the airway? Put one hand on the infant's head, one or two fingers on the infant's chin, extend the head slightly, not all the way back. All the way back will make the airway close. So just slightly, you will open the airway. Then put your mouth over the infant's mouth and blow for 2 breaths only. 1, 2. How I know that the breathing is going inside the lungs? You will see the chest rising. Once you see the chest rise, you will know that your breath, the one that you blow, went to the lungs of that infant. So how many breaths you have to give? 2. Once you finish 2 breaths, what to do? Continue again, start again, give 30 compressions. 30, then give 2 breaths. 1, 2. 30, 1, 2. Keep doing that until the emergency team arrive. Again, don't forget to call for the emergency in the very beginning. Assign somebody to call emergency or call from your mobile, put it on the speaker and start CPR. Keep doing it until the emergency team arrives. Now, CPR for children. It's the same, it's to save life for the child. Either a drowned child have been hit by car accident, child had fall from high distance, child had medication poisoning, child, whatever, deep, severe choking, whatever situation, when you see the child is unconscious and not breathing or gasping, having shallow breathing, you need to start CPR immediately. So start by shouting, "Are you okay?" to the child, shake his shoulder, "Are you okay?" If the child is awake, just go through the first 8 tips that you learned before and call emergency, stay beside the child, observe him or her until the emergency arrives. If the child is unconscious, immediately check for the breathing with your eyes. Look for the chest. If the chest is rising, that means that the child is breathing, so he is not in dangerous situation. Again, sit beside the child, observe him for any signs and symptoms of blockage, air blockage, or whatever, and wait for the emergency. Cover him if they are cold, if they are drowned, or whatever. Put them on the side. If the child is not breathing or gasping, once you assign somebody to call 911, start chest compressions. How many chest compressions you will do? 30 again. But how you will do it now? You can't use 2 fingers on a child's chest. Child's chest is bigger than the infant's chest. So you need to use one hand. Which part of your hand you are going to press with? The palm of your hand, the heel of your hand. Put it again in between the nipples, just the lower half of the sternal bone. This is the sternal bone, the lower half of the chest bone, or in between the nipples. Just put your hand, the heel of your hand, and press 90 degrees. How you will press? Extend your arm like this, and you have to start to press down 90 degrees with arms extended. So once you finish 30 chest compressions, again, put your hand on the child's forehead, 2 fingers under the chin, extend the head all the way back to open the airway. Once you open the airway, with the pandemic now issue, American Heart Association is not recommended to give mouth-to-mouth to, or even mask mouth to a child or an adult. So just open the airway, look if there is any object in the mouth, remove it. If there is nothing, continue in chest compressions. But I'm gonna teach you how to do the breathing in case you want to do it for God forbid, family members. So once you finish 30 chest compressions, tilt the head all the way back, pinch the nose close, seal your mouth over the child's mouth and blow 2 breaths. 1, 2. How you know that the breathing is reaching inside the lungs? Again, you will see chest rising of the child. Continue the same process. It's called the cycle. 30 and 2 is called one cycle. So you need to continue the cycles. 32, 32 until the emergency arrives. Now, let's say you are an area that have an AED machine. You are outside in the playground area, in the restaurant, in a cafe, and you see a child, and there is an AED machine. AED stands for Automated External Defibrillator. It's called defibrillator or AED machine. Immediately use the AED machine. How to use it? Just put it on and follow the instructions. It will give you all the instructions. You will take the pads, you will apply the pads on the child's chest, then you will wait for the instructions, follow the instructions. Once you give the shock, electrical shock for the child, resume CPR immediately, start CPR immediately. If that child is a little bit obese, let's say 8 years, 9 years, and they are obese, one hand is not enough to cardiac massage, to press on the chest to reach the heart. So you need to use 2 hands. This is the way to use the 2 hands. Look your first hand over the second hand, use the heel of your hand, and you can press like this picture. You can see that in the second picture. Where's my cursor? Here. Use 2 hands. Arms should be straight, and you need to press down almost 1/3 of the chest until you do cardiac massage. Again, 30, then open the airway and give 2 breaths. 1, 2. Continue the cycles until the emergency arrives. If you have somebody beside you who knows CPR, it's good to rotate in between you. CPR is tiring process, guys. It's like you will feel your shoulders start to ache, your arms, but you need to continue. This is saving the life. So if there is somebody else beside you who knows CPR, alternate between you and him, her to do CPR, or want to do chest compressions, want to do the breathing, then switch your places until the emergency team arrive. And with that, it's gonna be the end of my presentation or this awareness session. I hope inshallah it's clear. And stay safe, keep your children safe, keep your infants safe, and with God's wish. Thank you very much.